from the American Academy of Pediatrics.
In recent years, schools have gotten tougher. I don't mean academically, although that may also be true in some schools, but rather in how they discipline kids, including really young kids. But is it working? And what is the cost of all of this for a generation of children?
There's data to show that they're more likely to drop out if they're suspended repeatedly or expelled, drop out of high school, that is, and then all this time leads to unsupervised time, especially for our older kids and adolescents. And so unfortunately, there's a higher chance when a kid is suspended or expelled to be involved with the law, get in trouble with the law, and be involved, unfortunately, in the juvenile justice system.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we're diving into what is known about what works, what doesn't work, and what's straight up harmful when it comes to discipline in children in schools. To do so, I have with me Dr. Susanna Jain, who is an assistant professor of pediatrics at the University of California, San Francisco, and an author of a new report on this very topic. Susanna, welcome.
Thank you so much. Happy to be here.
Susanna, I want to start by sharing a quick story with you and with our audience. A few weeks ago, one of my patients came to see me after what her mom described as a really stressful situation in school. My patient is in the first grade, and she's so bright. She's a bit of a perfectionist, actually. We have been working on coping skills for when she gets things wrong. On the day of this quote-unquote situation, she did get something wrong. The teacher corrected her, and she just lost it. She started crying. She threw her stuff on the floor. She was sent to the principal's office to calm down. It was a whole thing. Her mom was called in. They talked it through with the school. They came up with a plan, and they thought things were good. But then they got this letter from the school saying that this was her first strike. It would go on her permanent record, and one more strike, and she would be expelled from the school. When I read this letter, I was shocked at how harsh the language was. And I have to tell you, Susanna, I got to writing my own letter stating how inappropriate this was and how important it was that this little girl feel supported rather than punished in the school. But the whole thing had this underlying tone of a policy that was put in place well before my patient came along, and that didn't really take the specifics of her situation into account. It was almost like the school felt like they had to do this because it was written somewhere. And I wish, Susanna, that this was the only time that something like this has happened in my practice. You have been researching this, and you just published a very comprehensive report of what's happening out there. Is what I just shared with you and what I am seeing in my practice happening across the country, Susanna?
Yeah, and thank you for sharing that story, because I know a lot of families listening can relate. I see kids with very similar stories in my practice too as a general pediatrician. And you're right, back 20, 30 years ago, suspension and expulsion were quite rare and really just used for behaviors that were violent or dangerous to others, just to be a wake-up call for that family that their student was going through something and having some dangerous behavior. But now suspension and expulsion are so much more common. We know that over 2.5 million students are suspended each year, according to the most recent data we have. That's 1 in 20 kids. So you can imagine one child in every classroom in America is suspended. And now the reasons that kids are suspended are like your patient, just acting out strong emotions, not really knowing how to communicate. We even have cases of kids being suspended from early childcare and preschool. These behaviors are totally developmentally appropriate, but unfortunately, sometimes teachers don't have the resources to deal with this, or the kid may have a developmental delay. And so it's really tough all around for educators, for parents, for the patients. And so we're definitely seeing this happen a lot now, unfortunately.
Yeah. Susanna, how did we get here? You and your team outlined this really well in the report that you just put out, and I encourage people to go to healthychildren.org if you're curious to learn more about this. But give us a little bit of the historical perspective.
Totally. Yeah. It's a really interesting phenomenon. In the 1970s and 1980s, there was this whole tough on crime policy going around in the federal government where we really wanted to have 3 strikes and you're out, or zero tolerance policies. And that language made its way not only into the government programs and the jail system, then these zero tolerance policies made their way into our schools. And so we started creating zero tolerance policies for things that made sense to keep schools safe initially, bringing a firearm to school, threatening a teacher. But then the schools sort of shifted those zero tolerance policies. And what I mean by that is if you commit this misbehavior, you are automatically suspended or expelled without any context of why the behavior happened. So these zero tolerance policies became applied to a lot of different misbehaviors by kids. So things like truancy, which doesn't make a whole lot of sense. Things like talking back to a teacher could get you suspended. And so it really has evolved. And that's why we have these huge numbers of kids now suspended and expelled compared to previous years.
Yeah. And by truancy, you mean missing school, right?
Yeah, and it seems a little counterintuitive that you would be removed from school officially for missing school. And that's not really helping kids.
Not helping at all. And it's so interesting that you say the zero tolerance policies, because that's exactly what is said in the letter that this mom received. It said, in this school, we have a zero tolerance policy for aggressive behaviors. And, she had an emotional outburst. We're working on it. She's followed by one of our psychologists, and they're working so hard to come up with strategies for those difficult emotions. This little girl is doing the work, and yet zero tolerance policy. Susanna, who is most likely to be on the receiving end of these policies?
Yeah, I'm so glad you asked that, because that was a huge thing that was really heartbreaking for me writing the policy statement, is that the kids who are most affected are Black students, particularly Black girls. There's a huge disparity for Black girls receiving about 50% of all suspensions of all girls of all races and ethnicities. Also, boys are more likely to get suspended, kids with lower socioeconomic status, kids with disabilities. So like you mentioned, it sounds like your patient was going through some counseling. So other kids with ADHD or anxiety, they more tended to receive this harsher discipline. American Indian kids are up to 3 or 4 times more likely than their peers to be suspended and expelled. And finally, LGBTQI students are also treated a little bit more unfairly when it comes to this.
Yeah. So anytime we talk about disciplinary policies and behaviors that are acceptable versus unacceptable in schools, there's always this counter argument of, well, schools need to keep kids safe. So my question to you is all of this actually making schools safer?
Yeah, and I understand the concern, because that's kind of the biggest pushback we get about trying to limit suspension expulsions. Are like, are schools going to become unsafe? Are there going to be an increase in, God forbid, school shootings? But the data does not show that. Suspensions and expulsions do not make schools safer. And we have 20 to 30 years of research to show that. So we need to be looking at alternatives, because what we're doing isn't really working, unfortunately.
Yeah, and I do want to ask you about alternatives, but before we go there, I also am very curious to know if there's data around what the effect is on the kids that are being suspended, that are being expelled, meaning on their learning, but also on their physical and mental health, Susanna.
Totally, yeah. And we do have a lot of good research to show that when a child is removed from school, they become less interested in school, mostly because you can think of how overwhelming it is if you've been removed from school for 5 days and you're trying to do the work at home, but you might not have necessarily that help from a teacher to help you learn the material. And then you go back to school, and then all of a sudden you're expected to keep up despite missing all this time. And that's just for suspension. If expulsion, the lack of resources during that period is even more severe. And so kids tend to become less interested in school. Unfortunately, there's data to show that they're more likely to drop out if they're suspended repeatedly or expelled, drop out of high school, that is. And then all this time leads to unsupervised time, especially for our older kids and adolescents. And so unfortunately, there's a higher chance when a kid is suspended or expelled to be involved with the law, get in trouble with the law, and be involved, unfortunately, in the juvenile justice system.
It's really just so many ways that these policies can affect kids. Now, Susanna, how do we strike a balance between attempting to make schools a safe place where kids can learn and doing so in a way that doesn't cause harm to children?
That's really the toughest question. And I'm glad there are a lot of minds much smarter than me working on this in the education field, in the juvenile justice reform field, and in pediatrics itself. We have a lot of great pediatricians putting their minds together on how do we solve this problem. A few things that we can think of are really limiting the scope of what suspension and expulsion are used for. So again, for behaviors that are violent, cause harm to theirself or cause harm to others. California has actually done something really cool where they've totally banned what's called a willful defiance suspension. So you can't be suspended for refusing to take your hat off in class if you're asked to, or talking back to a teacher. And that has actually reduced a lot of racial disparities, which is kind of cool. So really limiting the scope is one thing, and then offering alternatives, because this can be seen as a wake-up call for that child that they may have an underlying disability. They may have some emotional issues at play, and getting these kids the help they need. So I encourage the parents out there, if they've had a child who's been suspended or expelled, talk to your pediatrician. It may not seem like this is an issue related to pediatrics, but we are here for you, and we want to help your kid through this and get you the resources you need.
Yeah, so that was actually my question for you. I'm very grateful that I have a good relationship with my patient's parents, and this mom felt comfortable bringing this situation to me, right? And I got to work. Totally. I wrote a letter. I said, this is not how you address this behavior. It was a little bit of a how dare you, but I didn't say how dare you. But, if you're a parent listening right now and you want to help bring better policies to your schools, what can you do? What's within your control? Where would you start, Susanna?
Yeah, I'm so glad you mentioned that, because I truly believe parents are the best advocates for their kids. They go to bat for their kids all the time. And one way they can do that is just let their voice be known. We're constantly revising educational policies through new laws, especially I know in states like Maryland and North Carolina and California, there's a lot of new laws to really limit the scope of what you can be suspended and expelled for. So voting for legislators that feel the same way as you do about those laws is really helpful. Also, if your child themselves is affected by suspension and expulsion, make sure that they get an opportunity to continue to keep up with the classwork so that they don't lose interest in school, so they still have that joy for school. And you can work with your educational system to help you with that too.
Susanna, so that's working with your child at home, trying to keep them engaged, trying to, keep the joy for school, which can be tough for some kids if they feel like they've been in some way wronged, right? To say it that way by the school, but we do our best as parents. What can we do with the school itself at the school level to advocate for better policies?
Totally. So a lot of schools are already implementing programs to make the school climate more positive. So one of these programs, which some parents may be familiar with, is called Positive Behavioral Interventions and Supports, where teachers are working with kids to increase positivity in the school and help them understand the rules of the school. Another thing is called restorative justice. So in the school, there are counselors that can meet with kids that are having some trouble with managing strong emotions so that they can get the support they need. And so parents can feel free to ask their school if they're working on these programs. A lot of schools are. There's been a lot of reform already over the last 10 years where schools are becoming really open to finding alternatives. And so it never hurts to ask what your school district is doing and see if that can benefit your child too.
Yeah. Susanna, you kind of mentioned this in passing, and I have witnessed it, and it drives me absolutely insane. But talk to us about the suspensions that are happening in preschools. Like, how is that a thing, Susanna?
I know. I was surprised as well when I was looking this up. The data shows us 250 preschool kids, we're talking 3 and 4-year-olds, are removed from school every single day in our country. And this is for behaviors that are still developmentally appropriate, like maybe hitting a kid or biting. Of course, these behaviors are not ideal, but we're supposed to work with kids to help them through them, not just remove them from the schools. So that's one thing I really feel strongly we need to limit.
Susanna, I want to ask you, and I'm going to share with our audience something that's very personal, but being the mom on the receiving end of one of those phone calls, your child did XYZ, it's really difficult. Now, to be the mom on the receiving end and to be a pediatrician is a whole nother thing in itself, right? So my little guy's 3 years old, and I have gotten phone calls about hitting, right? And this started, when he was not even 2.5. And when I found out more information, it was sort of like, well, he was telling other kids what he wanted / didn't want. And when he wasn't heard, he used his hands, which to me, we need to correct. But also, is it really that out of character for a 2.5-year-old, right? So I had to sort of take a deep breath because I didn't want to be the problematic parent that was going to react very negatively and be like, are you kidding me? I'm a pediatrician. This is totally appropriate. I didn't want to be that mom, even though that's what I was thinking. So I took a deep breath and I just sort of said to the teacher, okay, what language are you using in the school? How can I help reinforce it at home? To try to foster a partnership and not be labeled problematic. That took so much out of me, Susanna, to do that. What do you recommend to parents when they get these phone calls? And sometimes it's almost like we have to prepare ourselves to be ready to advocate for our kids. What are your thoughts?
Yeah, that's so tough. And it really sounds exhausting. I know with my own kiddo, he's not old enough yet to go to preschool, but I can anticipate it being super hard, especially as a pediatrician mom, navigating these conversations. I recommend just trying to stay calm in the moment and take control of your own emotions. Because of course, when you're hearing this about your kid, you may have certain things come up for you, but just trying to understand what happened, the whole story. If possible, asking your child what happened, if they remember. It may be hard at this age, and trying to work through, like you were saying, some of these behaviors at home. But I definitely think that's not a reason to remove that child, but rather to work with them and see an opportunity for learning, as all kids are learning at this age.
Susanna, we like to end our interviews with a parenting prescription. Today, I'm going to expand that. If you had to give a school administrator listening today 3 specific recommendations of how to address difficult behaviors in school, what would you say?
Yeah. So I think number 1, understand that the kids in your school come from all kinds of backgrounds, and a lot of them, unfortunately, have had some really tough things in their life. And so understanding the context behind their behavior is key, and having the empathy, which we know you guys already have for kids, is huge in enacting school discipline. Number 2, school safety is highly important to us as pediatricians, but maybe limiting some of the reasons for suspension and expulsion to keep it to promoting school safety is in the best interest for kids. And then number 3, when a kid is suspended or expelled, let's keep their joy for learning by offering ways to keep up the learning while at home or when removed from the classroom, so that when they return, they can make the best of that unfortunate situation and move on and be stronger afterwards.
Jump back in and hopefully address the root causes. So for the parents, Susanna, we really can't end without your prescription for parents who are listening. What is your recommendation on addressing those difficult behaviors in school?
I definitely want parents to know that they have a lot of power as advocates for their children, especially if your child has a disability. Your child has a lot of rights under their individualized education program or IEP or their Section 504 plan. So talk to your school about the accommodations that can be made if your child is suspended or expelled, because they have a lot of ways to help your child succeed and thrive.
Thank you so much, Dr. Susanna Jane, first for the work that you do, and second for joining us today.
You're welcome. I'm so happy to be here.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Look for our episodes on YouTube and follow Healthy Children on Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
and our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho Sanchez. Thanks for listening.